Stand up. Stand up. We'll go down. So it looks like we're going to have a slot time for 500, and that will be used for our next meeting, for our dinner meeting or lunch. Okay. What is the cost? We will share this text. So nobody's logged in. But how do I change? Why does it come down at the bottom? Yeah, that's better.
Hello. Good evening, everyone. Thank you so much for the introduction. It is a great honor for me to actually give a talk at the Rotary Blossom Week today. I'll just begin with the topic. So today our topic is on how to stay young forever. So before that, it's important that before going into a topic, I would first like to say that it is very important that you identify that you go to the correct doctor. Okay. There are actually in India, there are a lot of fraudulent people who say that they are cosmetologists or cosmetic surgeons. Okay, there are a lot of courses that are coming up in India and outside, wherein even if you pass your 12th standard, even if you don't have, or those who have done some other undergraduation, can actually take up these aesthetic medicine courses and actually become a cosmetologist. Okay, so those are they're not aware of what the anatomy is, or what the physiology of a body is. They're not aware of anything. They just learn that this is to be done, this, that's all. So I want you guys to actually realize that and know properly who are your doctors, whom are you going to. Is the doctor whom you're going to actually a doctor, whether he has studied or what? Even after an MBBS, like Madam said about my introduction, I'm a plastic surgeon. It has always been my ambition since my MBBS that I want to be a plastic surgeon. So MBBS actually takes 5.5 years to study. I'm sure everybody knows it. It's 5 years of studies with 5.5 years means 1 year of internship. Then after that, if you want to become a plastic surgeon, you need to do MS General Surgery for 3 years. After you complete your surgical skills, that is in general surgery, complete and they get the degree, that's when you have to go for your super specialty, that is MCH. In plastic surgery or whatever you like gastroenterology, urology, cardiothoracic, it's like that. So I chose plastic surgery. So that is again a 3 years of studies which we need to do. Okay, so that comes itself to 13 years of medical studies that we do to actually become what we are. Well, just imagine a person who just maybe an engineer or maybe a racer. I have a friend who is a racer. She's a female. She's a racer. During the COVID time, obviously she was not doing the racing and stuff. She just went for a course abroad. She studied about just cosmetology, some procedures, and she came back and she has actually started a clinic, which is running quite well in Chennai. So people are still not aware of who's treating you. And anybody can do this without the knowledge of actually what it is. Okay, so most of the clinics in Kerala, Tamil Nadu are actually run by unqualified doctors. Okay, and only and there will be complications and deaths and all that, which actually is not come into the limelight, which we are not aware of. Okay, so and there are not much laws to actually bring into bars these quacks. They are called quacks. Okay, actually, in fact. So that's what. So there's even studies saying that that's why you hear, like hair transplantation was done and a patient died after hair transplantation. That's because it's done by people who are actually not aware about what the drug is, what is the dosage you have to give, how much you have to give, if there's a complication, how to deal with it. They're not aware because they're not medical people. It takes so many years to actually learn about the body and do what we are doing now. So please see the degree of the doctor whom you go to. So, and I also want to say the difference between it's a very common word that we hear everywhere and everybody's crazy about is cosmetology. Cosmetics. We'll all be like crazy about it. Okay, everybody wants to look good, everyone wants to be young. So the word it's a craze for us. So cosmetologist vere, cosmetic surgeon vere. I am a cosmetic surgeon. Cosmetologist is a dermatologist. Okay, a dermatologist is a person who studies this MBBS base. The basic to be a doctor, you need to study MBBS. And the MBBS mudichittu, adukapra they do their MD in dermatology, which is again 3 years. Okay, so that person can after that specialize in cosmetology. Okay, so basically they have also studied 5.5 years, 3 years, then cosmetology, which will be varying on what you take up, can be a year or 6 months or like that. So that cosmetologist, they don't do surgeries, they do procedures, non-invasive procedures. While cosmetic surgeon is the one who studied plastic surgery and then has become a cosmetic surgeon. So basically after my MCH in plastic surgery in Madurai Medical College, I did my fellowships. Non-invasive I did in abroad in Dubai, and I did my invasive plastic surgery at Chennai Plastic Surgery under Dr. Karthik Rao. So I was there for almost a year and a half. So like that. So identify the degree. It should be either MCH or at least it should be an MD. MD dermatology or MCH plastic surgery. It should be. Make sure you see these degrees before you actually go into the clinic and give yourself believing that person. Okay, so that's very important. Okay, now let's get into a topic that is how to stay young forever. So, as everybody says, to stay young, you need to have a good diet and exercise and sleep. அது எல்லாருக்குமே தெரியும். எல்லாரும் சொல்ற விஷயம் தான். So நான் இன்னைக்கு என்ன சொல்ல போறேன்னா அது கிடையாது. Something which you should mentally நம்ம அதுக்கு prepare ஆகணும். First, to be young, you need to be mentally. My husband is here. Okay, yeah. So you need to actually be first mentally prepared that you are young. So never say or think that you're old. Okay. So even whatever you do, think that you're young. Dress yourself like nobody is bothered. It's nobody's business what dress I wear. It's the way you dress yourself, the way you put your makeup, நம்ம shoes, whether it's high heels or flats. நம்ம like normally நம்ம நினைப்போம், ஓகே எனக்கு இத்தனை ஏஜ் ஆயிடுச்சு, எனக்கு என்னோட குழந்தைகள் இவ்வளவு பெருசாயிடுச்சு, நான் இந்த மாதிரி ட்ரெஸ் போட்டா ஆட்கள் என்ன நினைப்பாங்க. No, it's not like that. நம்ம மனசுல what age we want to be நம்ம நினைக்கிறோம். If you feel that you are just 16 or if you feel you're 21, that is what is going to reflect in you. And that is what is going to reflect to the people around you. உங்களுக்கு தோணுது எனக்கு 40 இல்ல, எனக்கு 45 இல்ல, எனக்கு 30 அந்த மாதிரி உங்களுக்கு தோணுதுன்னா that is what will show out what is in your mind, because your face is what the mirror is. Your face is going to be your mirror. You dress. So நம்ம என்ன பண்ணுவோம், when we feel young, we try to keep ourselves like that by நம்ம maybe makeup பண்ணுவோம், இல்லைன்னா நம்ம சின்ன procedures, facials, eyebrows, அந்த மாதிரி நம்ம update we'll keep updating ourselves. So நம்ம அப்படி பண்ணும்போது நம்ம will care about ourselves, that is face care, skin care, body care எல்லாமே பண்ணுவோம். So நம்மளே we should not think that we are old. Okay, so that's what it says, live the way you feel your real age is, not what others tell you to do. See, எனக்கு இந்த ஏஜ் ஆயிடுச்சு, இனி நான் ரெட் கலர் போட முடியாது, நான் கொஞ்சம் டல்லா சட்டலா அந்த மாதிரி ட்ரெஸ் பண்ணணும், சல்வாஸ் இனிமேல் என்ன அந்த ஃப்ளோயியான சல்வாஸ் போட முடியாது, நான் so it's all what we think. அது அப்படி கிடையாது. nobody நம்ம மத்தவங்க என்ன நினைக்க போறாங்கன்னு நம்ம யோசிக்கணும்னு அவசியமே கிடையாது. that itself will keep us young. ஸ்ட்ரெஸ் குறைஞ்சா நமக்கு ஃபேஸும் யங்கா இருக்கும். okay, then take the time to be beautiful. அப்படின்னா you should spend time for yourself. Like waking up in the morning helps all of us to actually have time. Like நம்ம எல்லாரும் housewives or working women, என்னன்னா நமக்கு we'll have to do cooking, we'll have to take care of children, send them to school, and அதெல்லாம் பண்ண வேண்டியதா இருக்கும். So what happens, end of the day, we don't have time to actually spend for ourselves. Maybe our hobbies, like book reading or ஒண்ணுமே பண்ண முடியாம. So ஒரு activity, ஒரு exercise பண்ணா you yourself will have those endorphins to keep yourself happy. Okay, so take the time to be beautiful also means that நமக்கு இப்போ we should have like ஒரு beauty parlor போனோம். Okay, என்னோட eyebrows வளர்ந்துடுச்சு, I need to do waxing, I need to, okay, my hair is grown, waxing பண்ணணும். நம்ம செல்ஃபே அழகா இருக்கணும். we want to portray ourselves. அந்த மாதிரி நம்ம யோசிச்சா, like we will start taking those steps to actually be young. நம்ம யோசனையிலே நமக்கு மனசுல சந்தோஷம் வரும். So you go to your parlor, you pamper yourself with a pedicure or a manicure. அது முடிக்கும் போது we ourselves come out confidently. Okay, my feet is beautiful. You don't have any problem about wearing a cut. I mean, not cut. I mean, அந்த எனக்கு word கிடைக்கல. Yeah, so you come out of the pedicure, you have beautiful nails, you obviously want to wear those kolapuris and all those, and the madita body. Okay, so treat yourself regularly to wonderful little things, especially if they seem unnecessary. Okay, நீங்க தோணும் என்ன நான் வீட்ல தானே இருக்கேன், வெளியே எதுவுமே போகல, so எதுக்கு நான் ஃபேஸ்ல பேக் போடணும், ஏதாவது பார்ட்டிக்கு போகும்போது மட்டும் நம்ம போடுவோம், அப்படி கிடையாது. The more you treat your skin better, the better it will be for that day. இப்போ உங்களுக்கு ஒரு ஃபங்க்ஷன் இருக்கு, லைக் மேபி ஒரு 4 weeks later, நீங்க இப்பவே அதுக்குண்டான எல்லாமே ரெடி பண்ணா you'll have a good skin and a glowing skin later on. Okay, அல்ல அது அப்பதானே நம்ம அப்ப பாத்துக்கலாம், அப்ப நம்ம வேக்சின் பண்ணோம், அப்படி இல்ல. So it's like that. So treat yourself. You don't have to have a function to keep yourself groomed up. Okay, so last is the 5th point, which is watch your figure closely. Okay, ரொம்ப முக்கியமானது அதான் நான் இப்ப சொல்ல போறேன். How to watch your figure closely. எனக்கு as usual எல்லாரும் சொல்ற அந்த ஃபுட் கரெக்ட்டா சாப்பிடணும், அதெல்லாம் கரெக்ட், அது எல்லாருக்கும் தெரியும்னு நினைக்கிறேன். I'm not talking about that. Okay, like you have to include your carbs, proteins, fiber, vitamins, எல்லாமே கரெக்ட்டா இருக்கணும். Okay, அது face lab, exercise. Exercise is very important. Okay, exercise. I'm not. See, exercise can be. It's not necessary. You have to do very high intensity workouts. Cardios பண்ணனோ or dumbbells பண்ணனோ அப்படி நான் சொல்லல. At least ஒரு walking for 30 minutes must be done. You know, out of the 24 hours that we have in a day, if we can't spend just 30 minutes exercise க்கு அதுவும் நம்ம பாடி காண்டி நம்மளால ஸ்பெண்ட் பண்ண முடியலன்னா I don't think we should live. It's just 30 minutes ஒரு 24 hours dayல we can't spend for ourselves. Why we exercise? So that our body remains young, stay active. So அது ரொம்ப முக்கியம். எக்ஸசைஸ் பண்ணணும். ஆனா எக்ஸசைஸ் பண்ணாலும் டயட் சாப்பிட்டாலும் பத்தாது. அது பத்தாம வரும்போதுதான் நான் இருக்கேன். Okay. So these are things which you do at home. But when all this is not working out, I'm there for you guys. I'm your savior. Okay. Okay. அது எப்படின்னு நான் சொல்றேன். Then I said that you need to spend the time for yourself. Daily நீங்க பேசிக்கா வந்து ஃபேஸ் வாஷ் பண்ணும்போது வாஷ் பண்ணிட்டு டைரக்டா துண்டு வச்சு தொடக்காதீங்க. தொடச்சிட்டு நீங்க வந்து மிரர்ல கொஞ்ச நேரம் பாருங்க உங்க ஃபேஸ். Look at your forehead. Look at your eyes. Look at your skin. How is your skin? Sometimes you after a face wash you'll feel, oh my face is so glowing, oh my skin is still nice, I'm still young. அப்படி தோணும். சில நாள் பார்க்கும்போது because of our hormones acting, சில நாள் பார்க்கும்போது கொஞ்சம் lines. Look for those fine lines. Look for that pigmentations. Look if you're getting those age spots and the scars. அதெல்லாமே பாருங்க. நீங்க அதுக்கு கவனிச்சாதான் வந்து you can give the proper treatment for it. Only if you rectify early, you can treat it early. The earlier you identify, the procedures or the things that you need to rectify that will be smaller. அது ஆழமா போய் இப்போ for example wrinkles வருது from the age of 25 itself due to our sun exposure, that's UV rays, UVA, UVB நால நமக்கு வந்து fine lines வரும். நம்ம அத க்ளோஸா நம்ம பார்த்தாதான் வந்து தெரியும் அது fine lines வர ஆரம்பிச்சிட்டு okay I should start using sunblocks, I should wash my face every day பண்ணணும். ஃபைன் லைன்ஸ் வரும்போதே நம்ம வந்து அது கண்டுக்காம அப்படியே விட்டுட்டோம்னா it will get deeper. Okay, when it gets deeper, when it's a very fine basic lines, you can maybe do a Botox or do a facial like PRP facial அந்த மாதிரி ஏதாவது பண்ணலாம் and the lines are going to go. But when it gets deeper, ஒரு Botox பண்ணா பத்தாது. You will have to fill those lines so that your skin again looks smooth. So அப்படிதான். So நம்ம earlier detect பண்ணா the earlier it is easier to deal with. So நம்ம எப்படி நம்ம figure watch பண்ண போறோம் நான் சொல்றேன். So in this picture these are faces of two ladies. One is a youth and the same lady in an aged face. So if you see the shape of the face, a youthful lady will have a face that is triangular. Okay, these are some secrets which I'm going to say, okay, which you need to start noticing from this after this meeting, or you can actually see your friends' faces and actually you can identify those aging signs. I'm going to teach you guys how to identify those signs of aging on your face. Okay, so a triangular face vandha youth ku irukum, aged face la vandu square shape ah irukum. Adu ye square shape nalladu I'll tell you. So in this picture, I'll start from up and come down slowly and show you what are the aging things. You can compare with, it's a half, compare it with the opposite side, okay? So starting with the forehead, hairline, if you see, there'll be a little bit of receding of hairline, okay? Second, namak enna agum, forehead la vandu fine wrinkles, lines theriyudhu, okay? Aduthathu vandu, pointer irukka, pointer illa. Okay. Third one, if you see the eyebrows compared to the compared to the left, compared to the left side, right side eyebrow is depressed. There is a ptosis of eyebrows. இங்க இதெல்லாம் நோட்டீஸ் பண்ணுங்க. வீட்ல போனா நோட்டீஸ் பண்ணுங்க. உங்க ஹஸ்பண்ட் பாருங்க, உங்க கிட்ஸ் பாருங்க. கிட்ஸோட ஃபேஸ்ல எப்படி இருக்கு, உங்க ஃபேஸ்ல எப்படி இருக்குன்னு பாக்கும்போது உங்களுக்கு அந்த ஏஜ் சேஞ்சஸ் தெரியும். ஓகே, நெக்ஸ்ட் ஒன் ஐப்ரோக்கு அப்புறம் கீழே ஐப்ரோவோட கீழே இருக்கிற அந்த லிட் கிரீஸ் பாருங்க. கம்பேர்ட் டு த லெஃப்ட் சைட், த ரைட் சைட்ல வந்து இன்னும் ட்ரூப்பிங் இருக்கு, எக்ஸஸ் ஸ்கின் மாதிரி தெரியுது. அப்புறம் லோவர் ஐலிட் பாருங்க, தேர்ஸ் a bag of skin in the lower eyelid. Then there is a big depression. You can see a big depression. Then on the cheeks, you can see the skin is hanging. Then near the nose, that area, there is a fold. And near the jawline, there is again loose skin. Why this all happens is because as Earth has gravity, our skin has been protecting and saving us from the time of our birth. Okay, the gravitational pull is always going to be there. As we age, avlo varshama nammala, you know, nammala apdiye vechirundha idu vandu age avandhorum it starts to loosen its elasticity, and the collagen koriyum, elastin fibers oda the strength koriyum. So there is all there sagging varum. So idella nama prevent pannalam, idella nama early kandupidicha. If I detect all these early, you can prevent it to a huge extent. Okay, so, and also lip, I forgot. There is a ptosis of the lip also as we age. Namma, when we see our face every day, na, we will not identify because it's a gradual process. So slowly it happens. Namakku difference theriyadu. But that's why I'm educating you guys about what you need to watch out. Okay. Adhe madha in the kanna. See, youthful eye and old age eye, and the eye mele irukra bag parunga. So there will be a loose fold of. Yeah. So this is the loose fold of skin that comes as we age. Okay. If you compare pannunga with your child and yourself, you paakumbodhu you'll notice the difference. Then below the eye, your wrinkles, and there'll be a depression. Okay. This is a picture of a male. Okay. See, the skin has almost become loose and it's almost hanging over the upper eyelid. And the fat, always our skin that is around our eye is always thin and very sensitive. And there's very little fat over there. So as we age, the skin becomes more, the fat under the eye always atrophies. And that is what is seen as a bulge over here. And the skin always thins out in the eye first. Eye is the thing that shows the sign of aging first. Yeah. In the depression part, very common, this depression. Okay. So, in the main panla. Okay, namakku aging or signs ella namakku kandupidichachu. Okay. So now what we can do first. Earlier, if we find these lines, you can Botox. Botox, what is Botox? Botox is actually it's called as botulinum toxin. Number one, in the lines varudhu. All these years, we have been using our muscles of our forehead, our eyes. When we smile, we are using all the facial muscles. So, and the facial muscles constantly contract our eye. So many years, what happens? The skin around there tends to get into that fold, and that's how we get lines. So, if we block that muscle action, we are not going to get that lines. So, muscle action block for totally block partially, depending on the dose of Botox that we use, we can block the muscle. It's like that. So, initial stages, Botox. So, it's used in my chinna needle use. We do the Botox. Yeah. So, now I'll show you some live pictures of the cases which I have done. And when I was in Chennai, and also some of my personal cases which I've done here in Mayo. So this is a case which I did, a Botox of forehead. She was a 33-year-old female. She had complaints of when she frowns, she had actually lines, deep lines, and also this the lower upper eyelid crease வந்து இப்படி கண்ணுக்குள்ள போற மாதிரி இருந்துச்சு. So she wanted to get Botox so that when she frowns, she doesn't get those. So this is that. Second, now, yeah. I said about the upper eyelid and the skin bulge. So what we can do for the skin bulge is that on the excess skin, we can excise it. That's all. Just remove that excess skin. And now this eyes, which was looking tired, ipo vandu idhula nalla brighter and the full open eyes we got. So this is called as blepharoplasty. So this is an upper eyelid blepharoplasty, which we did for this patient. Now, normally, in the lady, she herself felt it. I mean, she was aware of it and she felt it and she's come for it. And see the difference. We know how better she looks, how youthful she looks in this compared to this. Now, this is a picture of a girl. She was 26 years old, and she had tired looking dull eyes. Okay, and she had a sunken area below her eyes, for which we had done fillers. Fillers are type. You can use your fat from your own body can also be used as fillers, or you can also use hyaluronic acid fillers too. So this girl from her own body, we have used fillers. In the fat fillers use பண்ணும்போது என்ன ஆகும்னா it will stay for a longer time. It's long lasting. Side effects ஒண்ணுமே கிடையாது because it's your own fat. அவ்வளவுதான். So yeah. And this is also a picture of a boy, male. He had this bulging of fat and this depressed areas, for which we did again a fat injection. This is also similar like that. This girl, for her, she had a bulge of fat, for which we had done a fat reposition in that area. See, none of these scars will be seen. Scars are all, that's what we do. We are specialized in making everything scarless or less scar. So this is all done through inside, where the scar is not seen, but there is a scar, but not seen. Yeah. Adhe madri. Then later on, this is the lady who presented to us with deep nasolabial fold in the area, the cheek area, the deeper folds. These are all signs of aging. In the folds deeper go, and she had loose skin over here. So skin sag in a triangle contour of jaw, the skin loose it becomes square. Yeah. So yeah. So what we did this for this lady is that we did fat grafting of areas, and finally this is what she got. See, look how the difference between this and this. You can see how in this she on the folds has been smooth skin she's got. So we have done a fat injection for her in this. Next thing that has come up is that is all surgical, which I showed. The non-invasive, these are called as pedio threads. Okay, when you have loose skin, look at your face, look for your nasolabial fold. Just lift it a little and see. Okay, as you age, this fold becomes deeper. It becomes more deeper. Just lift it and see. You can feel that you look better and younger. So that means you have to do something for that. So what you can do is, one, if it's small one, you can do fillers. If it's a deeper one, we can do threads, wherein we use needle and thread like thing, and then just lift the skin like this and tighten it here. Okay, that is one. So in this picture, you can see this is a non-invasive way. Under local, we can do it. So like these threads we inject, where the direction of pull we want, like that from here we pull it and we anchor it here. Nothing will be seen now. There'll be no scars, nothing, and it will stay for around like 6 to 8 months. It will stay. The last thing, really very old, or 80-year-old lady presenting with very loose skin, we can go for facelift. That is a last resort. Yeah. Then another thing which I want you guys to know is we can slim our face by doing Botox. So நம்ம இந்த படத்துல பாப்போம், ஹிப் ஹாப் தமிழோட படம் நட்பே துணையில ஹீரோயின் பாருங்க. இன்னைக்கு வீட்டுல போயிட்டு கூகுள் பண்ணிட்டு நட்பே துணை அந்த ஹிப் ஹாப் தமிழோட ஹீரோயின் யாருன்னு பாருங்க. I don't know her name. You see her face, it'll be totally triangle. Okay, she actually came to us when I was in Chennai. She got a Botox of her masseter. Now, masseter muscle it's on both sides of her cheek. It is meant actually for clenching. Now, food tighten. If you tighten your teeth, you can feel your masseter muscle. So that for some people, hypertrophy. So adanala face wide. So if you want to slim your face, you Botox that muscle. You can eat. We are not giving powerful doses, but you can Botox that muscle and get that V shape. So this is, you see Nayanthara's face, she won't have like us. For hers will be like V from here. So that's all this. It's all Botox. So see, for us normally but you see from here itself, you be Botox with muscle, so you get the V shape. So yeah, latest technology. Whatever you want to do, everything is available actually. So this is another girl who presented with gummy smile. சில பேருக்கு சிரிக்கும் போது gums தெரியும். Gums தெரியும் போது நம்ம என்ன botox போட்டா அந்த gums மறைச்சுக்கலாம். Okay. Then yeah, some people have excess sweating. Underarms ரொம்ப sweat ஆகுது. Foul smelling ஆ இருக்கும் சில பேருக்கு. And they can't wear, men cannot wear grey t-shirt or ladies can't wear grey t-shirts போட முடியாது, grey dresses, blouses போட முடியாது. What we do is we do botox of the underarm. So it will help to reduce your sweating. Adhe mari palm. Some people sweat a lot over the palm. They'll be very insecure to actually hold even a paper wet or give a shake hand. So we can do botox of the hand too actually. So இதுதான். So நமக்கு wrinkles வந்து faceல எங்க எல்லாம் தெரியும்? On the forehead, these are the frown lines. இது நம்ம சிரிக்கும் போது இந்த சைடுல lines. Teardrop, nasolabial fold, mouth oda corner la. We can get in the corners of the mouth. We can get wrinkles. Then near the chin, and then neck. Yeah. எல்லாத்துக்கும் நம்ம botox பண்ணிடலாம். Okay. So at the stage நான் சொன்னேன் first botox அப்புறம் நம்ம lines எல்லாம் சரி பண்ண முடியல அப்படினா facials பண்ணலாம். கொஞ்சம் next stage எப்படினா by doing microdermabrasion. So basically you abrade the skin surface and the fine lines against the lines you do abrasion and then you can remove it. Okay, microdermabrasion. Then the most thing and the latest the in-trending the platelet rich plasma, also called as a PRP. It is basically growth factors. We take it from your blood. I'll show you this picture which we did in our clinic. This is what PRP is. In trend Madurai, a lot of people are coming for it. So what we do is we withdraw your blood in a syringe and we centrifuge it in a machine, and then we separate the blood into white blood and red blood. Okay, so the white color what you see over here is called as a plasma, and this plasma is what is rich in platelets, and it has immense amount of growth factors in it. You can see stem cells but it's growth factors. So in the growth factors நம்ம பாடியில எந்த இடத்துல போடுறோம் அந்த இடத்துல you can get ஒரு rejuvenation. For example, my husband ortho, he does it for knee pain வர்ற patients க்கு if you do PRP, almost I would say 90% of the patients whom we have done are very free of pain. My husband is actually a joint replacement surgeon. He's a specialist in arthroplasty and arthroscopy joint. So irrespective of age, any joint உங்களுக்கு வந்து சில பேருக்கு degenerative changes வரும்ல, end stage la da nama வந்து knee replacement பண்றோம், knee or hip replacement பண்றோம். But before that, those who are not willing or old age people who cannot walk or ரொம்ப bedridden ஆ இருக்கிறவங்களுக்கு you can try PRP. The good results are there, very good results of doing PRP. So what it does is that when you inject it, there are growth factors in it, and that helps to maybe create a cartilage or a synovium ellame konjam ஒரு திருப்பி ஒரு regeneration மாதிரி தான். அதே மாதிரி that's what he uses it for. I use it for facial rejuvenations, the fine wrinkles, lines எல்லாம் நான் சொன்னது. What it does is it நம்ம இந்த parlors போகும்போது when we do facials, it works நமக்கு ஸ்கின்க்கு 3 லேயர் இருக்கு. This parlorல facial வந்து நம்ம மேல உள்ள அந்த skin levelல மட்டும் தான் work ஆகும். That is at the stratum corneum levelல மட்டும் தான். But நம்ம வந்து இந்த medicated facials, dermabrasion, PRP facials, radio frequency facials பண்ணும்போது we are not just doing superficially. So நம்ம வந்து we act at the dermal level. அந்த dermal levelல தான் வந்து elastin collagen இருக்கு. Elastin, is it boring?
No.
Okay. So in the dermal level only we have this elastin and collagen fibers which actually help to keep our skin tight. சொன்னேன்ல aging ஆகும்போது skin loose ஆகும்னு. It's because of loss of elastin and collagen fibers. So dermal level we go and act on that. So what happens, the collagen which was looser in the fibers வந்து it gets tightened. More interlapping happens between the fibers and we get a tighter skin, a youthful look. Okay, நம்ம நீங்க வீட்டுல போகும்போது உங்க கிட்ஸ் உங்க குழந்தைகளோட ஸ்கின் தொட்டு பாருங்க, உங்க ஸ்கின் தொட்டு பாருங்க. அப்போ உங்களுக்கு டிஃபரன்ஸ் தெரியும். அவங்களோட இன்னும் திக்கா கொஞ்சம் ஃபர்மா இருக்கும். And ours will be a little. Thank you so much. So ours will be a little more thinner இருக்கும், கொஞ்சம் இதா இருக்கும். So yeah, what I was saying. So அப்படிதான் நம்ம facials பண்றது வந்து பார்லர்ல வேற. That is just superficial. You just want to look bright or something a day before நம்ம பண்ணலாம். But if you want a rejuvenated skin and the youthful look na, go for medicated facials. They help in giving more என்ன சொல்றது, longer lasting results you'll get because we act inside. Okay, so PRP என்ன பண்ணும், நம்ம ஃபேஸ்ல போடும்போது you get the growth factors will help you to create new cells and get a rejuvenated skin. அதே மாதிரி dark circles under the eye, it will help. You can improve the dark circles by putting PRP. Hair can நம்ம use பண்ணலாம். In this picture you can see I'm actually doing PRP for hair. If you have hair loss, early hair loss, you can put PRP. It will help you அந்த கொற்ற முடி கொட்டுதுல அந்த ஏரியால நம்ம போடும்போது அந்த டார்மெண்டா இருக்கிற ஹேர் ஃபாலிகல்ஸ் வந்து நியூ ஃபாலிகல்ஸ் will come, or dormant hair will be active ago, and whatever hair that is growing will be thicker and denser and smoother. So you can actually reverse it. So like men, androgenic alopecia, it starts from here. So those cases, those patients, we put PRP along that area and we have got good results. Hair growth is happening. So this is the latest technology that's come. So hair loss could have treatment. Pain வந்து we will give you local cream, anesthetic cream will apply. We have ice packs and you can see there's a vibrator. Pain will be there a little bit, I would say. Without pain you can't. Pain இல்லாம எந்த ப்ரொசீஜரும் கிடையாது. கொஞ்சம் பெயின் இருக்கும், நம்ம தாங்குற அளவுக்கு தான் இருக்கும். I do my maximum measures to keep the patient comfortable. Okay, I use vibrators, I use ice packs, I use local cream. எல்லாமே போட்டு I do it very comfortably for the patients. So pain இருக்கும், கொஞ்சம் அந்த கொஞ்சம் ஃபேஸ்ல பெயின் இருக்காது, scalp pain இருக்கும் because scalp has many nerve endings. So when I put this syringe is going to be very thin. You see, you hardly can see the needle. It's that thin. Poke பண்ணும்போது உங்களுக்கு பெயின் இருக்காது, ஆனா லைட்டா இன்ஜெக்ட் பண்ணும்போது கொஞ்சம் ஒரு இது இருக்கும். Okay, so like that. So these are the uses of PRPs. You can use it for stimulating hair growth, for cheeks and face. Your hands, as we age, our handless skin when the wrinkle agum, so you can use it for hands, around the eyes, your neck skin nickel. When you do your face, always make sure that you get your neck also done. That's important. Neck is the place that shows the aging first. This is a picture of we can do also hair transplant, ladies. Okay, suppose you feel that your hair is receding, we can take hair from the back little bit. It's like only the follicles we take. So we choose the follicles, good follicles, and we can bring you a new hairline in the front. So hair transplant, we do hair transplants. I do. Okay, this is actually this is only a 27-year-old male who is not married. Okay, he has a family history of hair loss, for which we did a hair transplant. And this after picture is just 10 days after the hair. You can see how much of hair growth he's got. And back, there'll be no scar. You can't see that the hair follicle was taken. It'll be very smooth and even. Okay, now upon the face, we understood what are changes. Forehead தெரியும் நமக்கு, இப்போ eyebrows தெரியும், upper eyelid, lower eyelid தெரியும், cheek தெரியும், nasolabial fold எல்லாமே தெரியும். Okay, now let's go to nose. Nose also undergoes change when we age. Okay, our nose will appear longer and it will appear like it's drooping. Okay, so அதுக்கு வந்து ஒண்ணும் பண்ண முடியாது, நம்மளால வீட்ல ஒண்ணுமே பண்ண முடியாது. Okay, so what we can do is we can do rhinoplasty. Okay, rhinoplasty. So this is a picture of a young girl, 17-year-old. She presented to me she was unhappy with her nose. She had a broad base of nose and her tip was broad, and she wanted a narrowing of her nose. But face should not change. The nose, it should not be obvious. Others shouldn't know. but it should, be subtle change. So this is the after picture that you see. This was the broad parts. Now you can see it's comparatively narrowed, and this which was smaller has been elevated, and the tip was broad one has been made sharp. That's a 1 month picture. This is another girl who presented. She's actually a post cleft lip palate repair done. She had always we get a secondary deformity of nose also along with it. So there's a lot of anatomical problem in a cleft nose. So correcting it, we need to correct the anatomy, and also physiologically they can't breathe. They have a complete nose block. So you'll have to correct the deviated septum and everything. So when there's a lot of anatomical problem, it is very difficult to actually correct. So this is the maximum I could get for her. So you can see here the columella was very depressed and curved, and here the ala was also flat, and the tip you can see is rotated towards the right, and it was broader. So now it's almost like straight, and I could narrow it and almost bring the tip to the center. And now her nasal breathing has also improved, and her voice is also slightly changed. She's very happy. So andha madri nama pannalam. And this is lips. That changes that happen in the lips when we age. This is a youthful lip, and as we age, we get fine lines, and lips start getting thinner, and the length between a nose and the lip will also increase. You can augment the lips by doing lip fillers. I think everybody knows about lip fillers. Okay, ini nama vande body ki varuvom. Okay, body. Spend time for yourself. Na moda sonnala. Spend time for yourself. Face wash பண்ணும்போது சொன்னேன், look out your face, என்ன changes இருக்குன்னு பாருங்க. Next, body. Maybe after a bath, before a bath, or after your workout. Mirrorல கொஞ்சம் time spend பண்ணுங்க. Look at yourself. Look at your tummy. Look at your breast. Look at your hips. Every day பாருங்க. Every day பார்க்கும்போது you will know what changes you have. How your hips are wide. See, நம்ம young இருக்கும்போது நம்ம waist வந்து it will be slim and our hips will be wide. But as we age, our waist becomes wider and hips look slimmer. So that happens. So look at the mirror, see yourself, see the changes that's happening. Okay, I'm getting இங்க கொஞ்சம் இப்படி இருக்கு அப்படி இருக்கு நம்ம பார்த்தாதான் வந்து நம்மளால அதை ரெக்டிஃபை பண்ண முடியும். நம்ம எக்ஸசைஸ் பண்ணியோ என்ன இருந்தாலும் நம்ம பண்ண முடியும். So now I'll just show you. Most important thing we all ladies need to know. Okay, body observe பண்ணும்போது dress இல்லாம தான் எக்ஸாம்பிள் அதான் சொல்ல போறேன். Breast பத்தி. Okay, lot of ladies come to me feeling insecure about the shape of their breast because the way the dress போடும்போது இப்படி இருக்கு, கான்ஃபிடன்ஸ் இல்ல, ஹெவியா இருக்கு, இல்லைன்னா physical problems like back pain அந்த மாதிரியோட present பண்றாங்க. So I want you guys to actually look at yourself. See, நம்ம வந்து what I'll show you is this is called as inframammary fold. நம்ம breast கீழே உள்ள இந்த fold இருக்குல்ல, this line is the most important line. So this will decide whether your breast is actually in a normal position or is actually started to sag or is it in ptosis. So in the line பார்க்கும்போது if your breast and your nipple area, this nipple area complex is above the line, that means you are good. Okay, that will happen only when you are young. That is before marriage, before your delivery க்கு முன்னாடி தான் அப்படி இருக்கும். So when this breast starts sagging beyond the line, that means you are having grade 2 of sagging armature nartham, ptosis you have started. Third is when the breast and the nipple is also below the line, means you're having severe sagging. Okay, and this is அதான் மொத்தம் எல்லாமே கீழே இருக்கு அந்த லைன். So அந்த லைன் பாருங்க, stand in the mirror, look through the sideல பார்க்கும்போது you will see the line. I can show you the picture. Okay, this is a lady. Okay, this is her inframammary fold. She's a lady who presented. She's actually 37 years old. Okay, Chennai paatha patient. We did a surgery for her. She presented with severe back pain. See, people don't realize that back pain varadu breast problem nalen theriyadu. Avanga back pain ku vandi they will go to ortho. They'll think that maybe எனக்கு couch குனிஞ்சு உட்கார்றதுனால கம்ப்யூட்டர் யூஸ் பண்றா இல்ல போன் யூஸ் பண்றதுனால தான் எனக்கு வந்து பெயின் வருது அப்படின்னு நினைச்சு they get diverted in during the treatment time. They get diverted. So actually breast நமக்கு ஹெவியா இருக்கு sagging ஆ இருந்தாலே நமக்கு வந்து back pain வரும். If your volume of your breast is big, you have tendency to get back pain. Back pain அது இல்லாம நமக்கு வந்து bra போடும்போது அந்த the bra strap pinching on your shoulder, these are all signs to show that the volume of your breast is high. Okay, and your posture won't be okay. எப்பவுமே நீங்க வந்து ஒரு என்ன குனிஞ்சிக்கிட்டு இருக்கிற மாதிரி இருக்கும். Okay, actually நான் வந்து I'm not Tamil. I'm basically from Kerala. So எனக்கு வந்து ஆனா நான் most of my life I have spent in Tamil Nadu. படிச்சுட்டே இருந்தேன்னா அப்படி எனக்கு பேஷன்ஸ் கிட்ட பேசுறது லாங்குவேஜ் தான், ஐ மீன் தமிழ் தான் எனக்கு நல்லா தெரியும். காமனா பேசுறது அவ்வளவு எனக்கு வேர்ட்ஸ் கிடைக்காது. Okay, so this lady, she presented with sagging breast. You can see this is her inframammary fold. The whole of the breast tissue and the nipple areola complex is beyond with light. So what we did is we did a breast reduction for her. We reduced her breast size and we gave her a lift, and she was very much happy. You know, she had suffered all this while, and now it has improved her confidence. வெளிய போறதுக்கு dress போடுறதுக்கு, and she was very much happy about her back pain. Totally resolved ஆயிடுச்சு. அந்த வெயிட்னாலே நமக்கு தெரியாது, அது யாராவது சொல்லி என்ன கரெக்டா சொன்னாதான் தெரியும். இதனாலதான் day before yesterday, a young girl presented to me with back pain. She has been being around with the pain for 2 years. நிறைய இடத்துல போய் ஆர்த்தோ பார்த்தாங்க, அப்புறம் பிசியோதெரபி பண்ணாங்க, செட்டிலே ஆகல. Finally my husband referred her to me. Husband physiotherapy வச்சாங்க. I hope he's not here. Yeah. Okay. There also a physio was done. Finally he referred her to me. I examined her and I examined her breast. So her one side breast is big and one side is small. She's only 21 years. Okay, she's not married. One side is big, one side is small. So because of that, she's having one side pain continuously. But nobody knows that it's because of this that she's having, and she doesn't know. And I don't know, somebody has told her in her young age, don't wear inners, don't wear bra. So because of that, her back pain has been increasing. I just told her one simple thing. She actually came to me 15 days back. You just wear a cotton bra and you come to me. If your pain settles, it'll be fine. இல்லைன்னா நம்ம பாத்துக்கலாம். She was having another problem, nerve problem இருந்துச்சு. So is it because of this or because of your breast you're having pain? நம்ம பாத்துக்கலாம், நீ இது போட்டுட்டு வா. 2 weeks கழிச்சு she came, that is the yesterday. பார்த்தா her pain has reduced. Her pain is reduced and she was happy. So basically ஒரு சைடு பெருசா இருக்கு, ஒரு சைடு விடனால she got a pain. I mean you can get pain. Uneven posture எல்லானால you can get pain. So என்ன சொல்ல வந்தேன்? Yeah, so அப்படிதான். So you can do breast reduction. அதே மாதிரி this lady also presented same thing. We did a breast reduction and a lift we have given her. Yeah, this girl, it's a young girl, unmarried, 24-year-old girl. She presented with low breast volume. She wanted her breast to be bigger in size because she was feeling not confident as her peer group. She was not able to wear a proper dress. And the madhi. So we did there are two options. You can either use implant or you can do fat injection. So implant and a problem now there are a lot of studies saying that you can get lymphoma, cancer, malignancy. So I don't do implants anymore. What I do is fat injection. We take fat from your lower tummy or your thighs, hip area la fat எடுத்துட்டு breast scar illama. Okay, there won't be any scars. Scar illama surgery. It's liposuction பண்ணி fat எடுக்கணும். நம்ம thighs or buttocks or tummy, lower tummy ல இருந்து fat எடுத்துட்டு we process the fat and then we inject it into the breast. எவ்வளவு volume வேணும்? This around 300 cc's of fat has been put. இங்க 300 cc of fat has been put in each breast. அது என்னன்னா வந்து there won't be any side effect because it's your own fat that you're using. We always நம்ம இப்போ ஒரு 100% fat போட்டா அதுல இருந்து வந்து 30% will இதாயிடும். It will your body will absorb it. It won't stay. Only ஒரு 70 to 60% தான் வந்து நம்ம போடுற வால்யூம் இருக்கும். நிறைய போட்டாதான் ஒரு இது வரும் அந்த மாதிரி. So you might think that, oh, we don't want so much. அது இவ்ளோ போட்டாதான் வந்து இன்னும் ஒரு 1 yearல வந்து உங்களுக்கு அந்த correct size வரும். So it's like that. So fat injection is the best for even after marriage. People breastfeeding எல்லாம் முடிஞ்ச பிறகு we'll have sagging breast. It's permanent. It's permanent. It's permanent. But if you do exercise and lose your weight, then that's also going to go. Workout பண்ண then so என்ன பண்ணனும், நம்ம workout பண்ணி முடிச்சு finish all your workout and you reach your ideal body weight, and then you come for a test fat injection. You will get that. Oh no. See, these fat adipocytes have stem cells in it. So that wherever you put, that's what I said for face. If you put it on the face, it will again give the rejuvenated look. They have stem cells in it. So adhe madri enge breast la potalu, it's good. Then many people present with axillary sleeveless போடும்போது இங்க bulge, bra bulge இருக்கும். So அதுக்கு நம்ம liposuction பண்ணி we can exercise the extra skin. அதே மாதிரி males, lot of male patients, we call this gynecomastia. Okay, male patients having male breast, male boobs, we do liposuction and gland excision, especially in the gym. நம்ம இந்த படம் பார்த்திருக்கோம்ல, சாப்பேட் பரம்பரை. Yeah. அதுல வந்து ஆர்யா, if you see note cleanly, if you see, he's got gynecomastia because அவர் இந்த பாடி காண்டி அவர் ஸ்டீராய்டு யூஸ் பண்ணாங்க. இது இந்த வீடியோ. Okay. Yeah. So steroid abuse la vandu we will get our gland. Even men have breast gland. So on the gland vandu perusagum. And in the male breast irukravanga, நம்ம எவ்ளோ exercise பண்ணாலும், நம்ம ஜிம்முக்கு போனாலும் அந்த அது குறையாது. It's like that. You have to get it operated. இதுக்கு ஒரே ஒரு வழி surgery மட்டும்தான், liposuction with the gland excision. So it's very common na, நம்ம எல்லா if you take 5 people, every I think 4 people will have. Yeah, that's what. So so adu kandida na idu actually solve so that people are aware of it. See, when I was in Chennai, that is like the hub of lot of cosmetic surgeries. People actually come and say, எனக்கு இது பண்ணுங்க, எனக்கு botox பண்ணுங்க, எனக்கு இங்க filler போடுங்க, எனக்கு breast fat fill பண்ணனும் அப்படினு சொல்லி they come with the procedure's name. So அந்த மாதிரி அது அந்த அளவுக்கு அங்க டெவலப் ஆயிடுச்சு. நம்ம மதுரையில people have yet to know. When I was in Chennai, people from Madurai come there, and then my sir would be like, she's from Madurai, now on you should go to her and not to me. அப்படினு சொல்லுவாங்க. So awareness வரணும் மதுரையில நிறைய. Yeah. And then tummy, how much ever you exercise and you still have that bulge which is always prominent and is not going, liposuction is there always. We can do an abdominoplasty also. If you have extra skin that is looser skin irukumbodhu, we can exercise that and get a flat tummy. All this is so namakku vandu you don't have to live with it. See, life comes once, so experience what your body can and be the best. நம்ம ஒரு வாட்டி தான் live பண்ண போறோம். So be the best, carry yourself the best way you can. Just don't think about anybody. அவங்க என்ன நினைப்பாங்க, இவங்க நினைப்பாங்க, என்ன நினைப்பாங்க. We don't have to think all that. Just go what you feel. Go feel your age and do what you want. Like that. With our lady, we had done liposuction for her bra rolls and side flank ellame. And yeah. Yeah. No age limit. Kids, kitna inna age varum? At least 18 years தாண்டணும். After 18 years only anything, rhinoplasty ellame. Then சின்ன இதெல்லாம் நம்ம பண்ணிக்கலாம். I mean, like for example இந்த மாதிரி warts, மருகு, அதெல்லாம் நம்ம remove பண்ணிக்கலாம். Major இந்த liposuction பண்றதெல்லாம் 18 yearsக்கு அப்புறம் தான். Okay, another thing, laser hair reduction, very important thing. I think we all should நம்ம shaving ko waxing ko We spend so much of money. We do waxing once every month, we have to do, and that hair grows back. Okay, நம்ம calculate பண்ணி பார்த்தா நம்ம waxingக்கு செலவு பண்ற money விட கம்மியா தான் வரும் லேசருக்கு நம்ம யூஸ் பண்றோம். லேசர் என்னன்னா எல்லாரும் everybody thinks that it is something ஏதோ ஒரு பெரிய லைட், it will cause cancer and என்ன ஸ்கார் வரும் அந்த மாதிரி எல்லாம் everybody thinks, but it's not at all like that. Laser actually, how I'll show you. This is the laser machine and this is the probe. It is so small. Okay, first the skin and the hair nama shave pannittu we do laser. We apply full jelly over, and from this laser it will be just a beam of light. And this beam of light, what it does is it only targets the black pigment of your skin. அதாவது வந்து நம்ம முடி வந்து கருப்பு முடி இருக்குல்ல, அந்த கருப்பு பிக்மெண்ட் மட்டும் தான் it will target, not your skin, because your skin is light color. Black color எங்க இருக்கு அதுதான் அதனால இது பண்ண முடியும். நம்ம ஃபேஸ்ல வந்து when you go to a dermatologist for pigmentation or something, what do they say? They suggest laser, right? Why? Because it is pigmented. அது darker color ஆ இருக்கு உங்க மத்த skin விட. அப்ப லேசர் வந்து எப்பவுமே pigmented color, I mean dark black or very dark colors மட்டும் தான் it will work. Okay, so what laser hair removal does is it just targets that black pigment. Your skin is not good, nothing is going to happen to your skin. Well, as your skin is going to be super smooth and it's going to be much softer, and throughout the year you don't have to think about wearing a sleeveless dress or wearing a skirt. Ayu na iniki sleeveless dress போட முடியாது, hair இருக்கு. You just don't have to keep the dress back. Oh, இன்னைக்கு போட முடியாது, இன்னொரு நாள் போடுவோம். Actually, well, in fact, I was supposed to wear a skirt. I couldn't wear that because last minute I too have to get a laser hair removal done. I'm actually doing for others, but I haven't got done for myself yet. So it's like that. Technology மாறிடுச்சு. It doesn't do anything. It's a very ரொம்ப மைல்டான ஒரு இதுதான். But people have this fear which has to be broken through. When I went to Chennai, the laser patients, when you don't have time to do, you don't have time to sit. You have to just continue. Patients varanga. They say full face, full body, underarms, and the madri, full legs, full hands, and the madri, we'll get tired. You in a day you can do only maybe 5 full bodies, and the madri. So avlo common aidichi. Ipo nama abroad Dubai pogumbodhu, you can't see anybody with you can't see anybody doing waxing, shaving and all. நமக்கு என்னன்னா அந்த பேஷண்ட் பார்க்கும்போது நமக்கு we feel embarrassed, like ஐயோ அவங்க எப்படி அவங்க ஸ்கின் வச்சிருக்காங்க, so super soft-ஆ இருக்கும், won't be any pigments. இந்த மாதிரி waxing பண்ணும்போது என்ன ஆகும்னா, when we do waxing, the hair that grows up you'll get ingrown hair, or when you do shaving you tend to get those spots in the areas where the hair growth happens, or ingrown hair comes, which is again a big problem. So and the scars edume idhula varadu. So laser is a very safe thing to actually undergo, which people are not aware of it. Below 18, I don't do that. I do 18 and plus. Below 18, we can do it, but depend like yeah. Yeah, but I would I don't. No, that's what I'm saying. 18 and plus, yes. Till 18 years, I would suggest shaving. A laser. First thing I'll say, laser is not hair removal. It is hair reduction. So one sitting of laser is not enough to remove your hair. You need series of sittings. Okay, at least minimum of 6 sittings. Face hair growth is faster. You might need 6 to 8 sittings. While body hair growth is slower. Maybe by 6 sittings you might be okay. But basic minimum is 6 sittings. Plus, if you don't, some people have very thick, coarse hair on the legs and hands. Ladies and gents and for them, they might need more sittings. Okay. Hormonal changes, that is like PCOD. Unless you correct the hormonal issue, the hair is going to grow. So that issue needs to be corrected first. Along with that, simultaneously, we can do laser hair removal. What laser hair removal does is, each time you do laser, bam, bam, it will make your hair thinner, finer. It is not going to remove it. It's going to make it thin, fine, such that you can't see. It's a reduction, not removal. So your hair, you can't see. You might have done an upper lip hair removal unless you a hair laser. Mirror la poi nama keena paatha. Illana somebody sees our face very close, then only you can see the hair. But when you touch and see, there will be hair. But theriyadu. It'll be that fine. So that's what laser does. Other than hormonal issue first correct பண்ணிட்டு தான் இது பண்ணணும். Simultaneously பண்ணலாம். See, in this picture, this girl presented with PCOD only. She had PCOD. She was on this cyclical therapy, and simultaneously she was doing, and she's got a good result. No side effects, unless you get it done by a proper trained doctor. Now, normally everywhere, or a trained nurse is also okay, or therapist, laser therapist panna okay, but you should have training for it. If you don't have proper training, chances of getting burns is there. So that's what I said in the first slide. Choose your doctor, know whom you're going to. Yaar pandranga edun paakano. This is a small girl who presented with a recurrent keloid of her ear, for which we had done. She had already once removed it, and then she came back again, and we did a removal followed by keloid recur agum. We need to do an intralesional keloid excision, and followed by that you have to give triamcinolone injections. Triamcinolone injections, 3 doses, 6 doses, 3 weeks apart. So she had done that. Triamcinolone injection வந்து 6 dose போட்டா 3 weeks gap la correct போட்டு. You need to have compression. Like it's a common place of sternum. Lot of people get over the sternum, thick lesion இருக்கும். So என்ன பண்ணோம், கம்பெனி இப்ப காதுக்கு வந்து I gave her a nice hard clip. So you have to maintain that for 3 to 6 months. அந்த மாதிரி. First, initially you'll have to wear continuously. அதுக்கப்புறம் you can wear in the morning, remove it at night. அதுக்கப்புறம் night அந்த மாதிரி. So now she's happy. It's almost been 1.5 years, and she never had any recurrent lesions. அந்த மாதிரி. Then ear hole repair, and that's all. That's about. So I hope you guys have understood how to actually look at yourself carefully, identify the signs of aging, and mentally think that you're still young. Don't just listen to what others say that you're too old, you're wearing this dress. Illa namak enna feel pannudho and madri nama dress like it's nobody's business. That's all. So, and so kindly support because this is actually my husband is the one who motivated me to actually start a clinic exclusively for cosmetic and plastic, and this is the first one in Madurai and almost in down south exclusively. Actually, in plastic surgery we do general plastic. I do a lot of trauma, hand injuries, facial injuries, ellame pannuven, but my interest has always been only for cosmetic, and I want my patients to be happy, and and my interest is to contour bodies to make people to make ladies confident. Liposuction, tummy, நம்ம எதுக்கு வயிறு வெச்சு நம்ம கஷ்டப்படணும்? You can just go ahead and do it. Why suffer? Why be insecure when you can do things? Just do it. So yeah, so yeah, yeah. I'll be constantly posting my procedures now, panda surgeries, pre-post ellame I'll be constantly putting in my Instagram, Facebook, and my Google, so you guys can follow me on Insta. So it's a new thing, so much time agum. So yeah.
Any more?
Oh, okay. One major thing I would like to say is I will not tell any of my patients to do this. It is you yourself have to feel that you have this, that and when you do the surgery or the procedure, that's when you will feel happy. I don't tell anybody. See, patient, there'll be people who will be coming with me for a lip problem, a lip something, or a lip revision, or a cut, or something, some trauma or scar. They want to do a scar revision, they want to make it scarless. But the patient's nose might be very bad. It might be broad. It might be, and like a tono, solonon tono. But no, I cannot force a patient to do this. It is your consent should be there. It is your wish. Unless உங்களுக்கு இப்போ நிறைய பேஷண்ட்ஸ் வருவாங்க, நிறைய லேடிஸ் வருவாங்க, ஹஸ்பண்ட் ஆர் நாட் ஹாப்பி. I didn't deal with the gynecological plastic surgery, but like vaginoplasties, hymenoplasty, vaginal tightening. A lot of ladies come saying that their husband wants tightening. Ladies, they will not be happy at all. So I have to actually I'll counsel the husband, because the lady might not be willing. First, I'll talk to her, ask her what does she want. அதுக்கப்புறம் தான் கவுன்சிலிங் பண்ணணும். And unsatisfied patient, a patient who doesn't want to undergo a surgery and I do it and the patient is not happy, then that's not my purpose. So நான் யாருக்குமே வந்து இது பண்ணுங்கன்னு சொல்லவே மாட்டேன். நான் உங்களுக்கு சொல்லி கொடுத்திருக்கேன், இதெல்லாம் நீங்க பாருங்க, பார்த்து உங்களுக்கு ஃபீல் ஆயிடுச்சுன்னா நான் உங்களை ஹெல்ப் பண்றேன். Botox is 3 to 6 months. You'll have to do sittings. Botox அப்படி side effects ஒன்றும் இல்ல, மசில் மட்டும் கொஞ்சம் paralysis மாதிரி இருக்கும். More sagging. See, I like it. See, that is what proper anatomy is very important. Suppose you're getting a Botox of your forehead. Your forehead muscles and your eyebrow muscles are very close by. Unless you know the anatomy correctly, you might accidentally inject into the eyebrow, and that's when you'll get a ptosis of your eyebrow. Yeah, it's very close. Only if you know the anatomy. Fillers, I'll tell you. Filler stays for 6 to 9 months. Okay, while a fat stays forever. Okay. Filler, I'll tell you, one filler will cost you 45,000. That's the cost of the filler. Yeah.
Some people do it in their lips also.
Right? Yeah. Threads will be almost around that. Everything is the product or the cost. But fat is again surgical. You have to undergo anesthesia. But that's long lasting, no?
That's permanent.
Yeah, that's permanent. Depends on which area you want to do. If you want to do breast, it's going to be face. It won't be lax. It wouldn't be lax. It'll be less than that. But it's a procedure. It will take time. Now you have to do liposuction. There's the involvement of a lot of instruments and people around you. So, but it won't be lax. Don't worry. Dark circles. There's a reason. So you need to, I'll tell you, liposuction பண்றதுக்கு வந்து patient ஓட BMI is very important. A patient who has a BMI that is very high, I wouldn't do liposuction, because first அவங்களுக்கு healthy lifestyle explain பண்ணனும். They have to maintain a healthy lifestyle and be active. அதை exercise பண்ணி கொஞ்சம் நீங்களே choose பண்ணிக்கலாம். So நம்ம வந்து So first I will counsel the patient about எப்படி lifestyle நீங்க என்ன diet maintain பண்ணனும் என்ன exercise நீங்க பண்ணனும். You do this, get me a weight loss at least of a kg or 2. அதுக்கப்புறம் I'll do liposuction. Okay. First of all, liposuction பண்ண பிறகு நம்ம அந்த diet, if we don't maintain, if we don't be active or you don't do exercise, what happens is that நம்ம fat எடுத்த இடத்துல fat வராது, எடுக்காத இடத்துல so it is important நம்ம எதுக்கு liposuction பண்றோம்? Because we want to remove the fat and slim இருக்கணும்னு நினைச்சுதானே நம்ம பண்றோம். அப்புறம் போய் நம்ம சாப்பிட்டா அப்புறம் procedure waste போயிடும். So அதனால I only counsel the patient. I will see if it's the right candidate and then only I'll do it. If I feel that patient is not right and is not going to follow the diet and is very obese, I will not do, because that patient is going to create a bad name for me. So நானும் liposuction பண்ணேன், எனக்கு ஒன்னும் வரல, எனக்கு அப்புறம் நான் இன்னும் fat ஆயிடுச்சு அப்படின்னு சொல்லி, this is how illiterate people, not illiterate, I mean people who are not aware about all this, this is how they spoil the industry. So it's very careful that I choose a patient correctly. Right candidates only complicated. Dark circles வந்து எதனால உங்களுக்கு dark circle வருதுன்னு first கண்டுபிடிக்கணும். The various reasons for it. Number 1 வந்து sleep, lack of sleep, stress, lack of sleep. Sleep நமக்கு at least deficiency வரும். Allergies at night தூங்காம, yeah. Then dye, hair coloring, dye, allergies, so all this அது நம்ம rectify first அது கண்டுபிடிக்கணும். கண்டுபிடிச்ச பிறகு we can treat. If அதெல்லாம் வெச்சு, if your dark circle is not because of all this and it's just because of physical things like நான் சொன்ன மாதிரி loss of fat or depressed eyes, அதெல்லாம் நம்ம சரி பண்ணிக்கலாம். You can do fat injections or fillers. You can do, first அது லைட்டா இருந்தா நம்ம வந்து PRP பண்ணலாம், PRP facials பண்ணலாம் அந்த மாதிரி. So yeah, it depends on what type of pigmentation. Melasma is a tough one, but you can lighten it. It's not curable. I actually have pamphlets. Ennalam procedures nama clinic la pandrom. I have pamphlets of it. So if you who are interested can have a look at it. Sure. Yeah, yes, I have no, yeah, we have no, really, Kripa knows about it.
When you wake up in the morning, and what to do for patients and yoga. Just get up in the morning and take an appointment and go. She pregnant, you feel exercise. Basically, face
yoga, but I'll tell you. First thing, you wake up in the morning. Okay, I'll tell you. First thing, when we wake up in the morning, you need to wash your face. Okay, use a good face wash. Okay, a good face wash. Dry your skin. Apply sunscreen. A good sunscreen. Every day. I've been using it for the past 15 years. I have been using. Yes. Every day you need to use sunblock. Every day, in spite of what, even if you don't go out of your house, put a sunblock. Okay, because nama room வீட்ல இருக்கிற tube lights lightsல எல்லாமே ultraviolet rays இருக்கும். So use a sunblock, very important. Always, whatever happens in the world, use a sunblock. And sunblocks வந்து எப்பவுமே it stays only for 3 hours. You have to reapply it. So if you apply it at 9 o'clock, reapply it at 12, reapply it at 4. It's like that. At least வீட்ல இருக்கும்போது at least ஒரு வாட்டியாவது. But when you go out, this is important. Like now, if you're doing a lot of driving or you're going to beach போனா கண்டிப்பா 3 hours நீங்க reapply பண்ணுங்க. You going to all this? Okay. 9 o'clock you put at 12 o'clock and at 4. Very important. Night போட தேவையில்லை. Because wherever there's sun, wherever there's ultraviolet rays, that's where you need sun protection. And this is my only thing. Moisturizer கூட நான் suggest பண்ண மாட்டேன். But must வந்து face wash பண்ணுங்க. Twice a day face wash பண்ணுங்க. And sunblock போடுங்க. Sunlight இருக்கிற வரைக்கும் sunblock இருக்கணும். அதுக்கப்புறம் நீங்க wash பண்ணிடலாம். That's all. மத்தபடி இந்த serums, retinols அதெல்லாம் எனக்கு தெரியல. That's not my 30 is a minimum. Yeah. Now in lots no போடலாம். You can put. Only thing அதோட consistency கொஞ்சம் திக்கா இருக்கும், கொஞ்சம் இதா இருக்கும். But minimum 30 தான். 25 எல்லாம் போகாதீங்க. Put 30%, 30 SPF. இப்போ வந்து நிறைய sunblocks you get that matte finish. Earlier na mundi these sunblocks are very oily. They give that oily thing. When you go in a lift, you know, when the light comes, you look like full white. So adala ipo mari pochu. You get all this matte finish sunblocks and everything. So adu podlam. So pimple varravangalukku oily skin ku aduketha madri sunblocks. Dry skin ku aduketha madri sunblocks ellame vandiruchu. So these two are the must. That's all. இதுதான் என்னோட ஸ்கின் கேர் ரொட்டீன். நான் எல்லா பேஷண்ட்ஸ் கிட்ட சொல்றது இதுதான். மத்தபடி மாய்ஸ்சரைசர் எல்லாம் ஒன்றும் எனக்கு தெரியல. அது டெர்மட்டாலஜிஸ்ட் தான் தெரியும். Also one more thing, dark circles சொன்னீங்கல்ல, நம்ம skin you do one thing, dark circles இருக்குன்னா you want to see if it is because is it a pigmentation or is it because of the sunken skin. என்ன பண்ணலாம்னா pinch your skin and see, pinch it and see how it is retracting. If it is retracting very slowly, that means elasticity of skin is less, skin loose ஆ இருக்கு. இல்லனா stretch பண்ணி பாருங்க, stretch பண்ணும்போது அந்த கருப்பு is reducing. That means it is because there's a hollow space. Inject பண்ணனும். You have to fill that space. Just retract like this கண்ணாடியில and you feel அந்த கருப்பு குறையுது, the darkness has reduced. That means it's better you go for some injectors. இல்ல கருப்பு குறையல அப்படியே தான் இருக்குன்னா that means அது pigmentation. அதுக்கு these are just small things. இதெல்லாம் நான் இப்ப சொல்லிட்டேன். இதெல்லாம் எனக்கு எப்பவுமே I actually, you know, by seeing a patient's face, I can say almost approximately the age of the person. By seeing these things which I said, the fold, the eyes, the wrinkles, எல்லாமே வச்சு நம்ம சொல்லலாம் age of the person. So now these things you guys know, you can see around your friend's face. And you can see.
Go and see ourselves.
you see yourself and see your kids. That's when you'll understand. So then you should say, okay, how do I be like my kid? Oh, that means I need to do this. Oh, yeah, sure.
How come you got so much shine on your
Sunblock.
Malayali born.
My skin is glowing. I'll tell you, my only secret is I've been using sunblock for the past 15 years. That's all. I don't put anything. My basics are only. You're more shinier than me. Yeah, it's the lighting, yes. Yeah.
No, but you definitely have a lot.
Thank you. Lighting nala.
I'm going to deal with the vote of thanks. We had a wonderful session by Dr. Sheetal today.
I'll just take that.
Okay. Thank you, Doctor. I believe you were all impressed with her presentation and her expertise in the area of cosmetology. Now let's all plan for how to look and feel like we are in our 20s. We had shared the flyer for today's event yesterday with other Rotary Women clubs, and many mentioned that we should plan this event at a district level. We are glad that we had this event today, and many thanks to Dr. Sheetal for immediately accepting to come and have a session with us today. Our next club project is ICANN, and it's on 12th Sunday morning. We are doing this project along with RJ Tamil Nadu Charitable and Educational Trust. We request our members to join us for the event. We also look forward to all of our buddies exchange plants and have them planted this month. And before we leave, we have a sunshine box here. Any amount, any small or big, whatever you contribute goes to the club and will be used for the projects.
What is it for getting this?
It's a sunshine box. Okay. You could put in any amount and we use for our projects.
From next week you want.
Yeah, next week.
You mean this time last week?
Oh, I know.
And please do join us for dinner once the meeting is adjourned. Thank you and good night.
Before that, யாரெல்லாம் நீங்க ரோட்டரி பின் பண்ணலையோ ask them to put 100 here.
Rotary pin.
இன்னைக்கு யாரெல்லாம் ரோட்டரி பின்
கொடுக்கலல்ல.
not next time. ரோட்டரி பின் இன்னைக்கு பண்ணாதவங்க எல்லாம் today I got